Welcome all. Let's get started with today's Patient Perspective Roundtable series titled Gynecologic Cancer Survivorship Care Survey, What We Learn. We will be reviewing over the survey results from the recent Survivor Patient Survey on survivorship. We are grateful for the women who took the time to complete the survey. I am Daniela Luvero and the chair of the IGCS Advocacy Committee and a gynecologic oncologist from Italy. Today, I'm very happy to be here and join with Dr. Rose Glasspool, the Vice Chair of the Advocacy Committee and medical oncologist from the United Kingdom, and Dr. Abhishek Shankar, member of the Advocacy Committee and radiation oncologist from Preventive Oncology based in India. Thank you both for joining me today as we review the recent survivorship survey results. We are excited to have two amazing survivors share their perspective of the results with us today. The first is Manisha Koirala, is a Nepali actress and best-selling author of Healed, a memoir sharing her cancer treatment story. Are you Manisha here? So unfortunately, there was a change in plans and Manisha is unable to join us today because she's currently on set filming, but we are able to record her early this week. We will now play a video introduction from Manisha, please.
Hi, namaskar. This is Manisha Koirala. I'm ovarian cancer survivor, and I was diagnosed with late stage of ovarian cancer in 2012. And after multiple examination and making it sure, I got my treatment done in New York, and my treatment got over in 2013, April 30th. And since then, I've been cancer-free. It's, I think, now 10 years I've been cancer-free.
We will play another video from Manisha at the end of the program. We encourage you all to stay until the end to hear more about her survivorship journey, an amazing journey, and her thoughts on survivorship care. Our second survivor with us today is the amazing Eva-Maria Stromsholm. Eva-Maria, will you please introduce yourself and share briefly your cancer history?
Yes, hello everyone. Thank you so much for letting me be here. I'm so honored and thankful for this opportunity to be a part of IGCS Advocacy Network. And this survey has been really important for many patients and caregivers, and I'm so excited to hear the results. My name is Eva-Maria Stromsholm. I'm 41 years old from Finland. I'm working as a nurse, but also being a teacher and an active patient advocate in Finland and also in Europe. I have co-founded and I'm a vice chair for gynecological cancer patients in Finland. Today I'm 41 years old, but my cancer journey began in 2008. I got my ovarian cancer when I was 27 years old. At that time, I didn't know anything about cancer or treatments. I had no symptoms that something could be wrong. It was a regular checkup with my doctor, and he saw something on my ovaries. They thought it was a benign tumor, but the pathologic answer told different. It was a rare form of ovarian cancer called dysgerminoma. For me, I remember it was a shock, being a healthy athlete and person doing my job and then being a cancer patient. At my first surgery, they took away my ovary and a tumor. After looking at the tumor, they saw it was malignant, and another bigger surgery was done. I did not need any treatments after those 2 surgeries. But half a year later, I got pain in my back, and they did an ultrasound on my kidney, and they saw something in my kidney. I had got a relapse. A third, even bigger surgery was done after the first one in a year. They took also away the kidney, and the recovery was very hard. I started chemo, and I got 22 times chemo in 3 months. I was in really bad shape. A few years after this treatment, I could go back to work, but still suffering from fatigue and hypothyroidism, and got into menopause. Also, late side effects was coming quite soon. And some years after this, when I got into the menopause, also I had to get hormone replacement. I had a small myoma. It is a benign tumor in my uterus, and it was growing. So I had to do a surgery, and I decided to take away the other ovary and the uterus. So that meant I could not get children anymore. But even if I'm struggle a lot when I was young, and still today struggling, but I have no cancer left, I'm a positive person, and I really enjoy life. So for me, it's important that cancer patients get the right treatment in right time at the right place, not forgetting psychosocial support and peer support. And therefore, I'm really happy to be active in many different organizations to support cancer patients. Thank you.
Thank you, Eva-Maria. You are a very amazing person. You had balance, family, work, and the disease. It's really, really important for our women. It's an important message. So before we get started, I want to mention a few housekeeping
Namaskar.
items. Please know that a recording of this webinar will be available on IGCS Education 360 Learning Portal by this weekend. We encourage you to submit questions via Q&A feature at the bottom of your screen, and we will do our best to address as many questions as possible, please. Please take your microphone mute. Now I will turn this over to Dr. Glasspool, my partner in crime.
Thank you very much, Daniela. And I just want to say thank you to everybody on the panel. It's a great honor to be with you and on this important project and to be able to present the results, and a huge welcome to everyone who's joining us online. So first of all, what do we mean by survivorship? Because I think it's not a term that people are necessarily that used to, but for the purposes of the survey, we defined a cancer survivor as anyone living with a history of cancer from the diagnosis right through the remainder of life. And actually, most of the survivors felt they agreed with that definition, but there were 7% that didn't, and they actually made some very helpful comments. I think we very much wanted to try and capture everybody, really, because we know that once you have a diagnosis of cancer, life does change, but the needs and challenges that people experience do evolve over time and may be very different with different cancers and different situations. So we wanted really to include everyone who was living with and beyond a diagnosis of cancer. But I certainly recognize that the war analogy, the sort of survivorship, the battling, is not something that everyone feels comfortable with. And I think we're still looking for a better term. So very willing to hear suggestions. But that was really what we wanted to do, to recognize that some people will sadly have a recurrence, others may be at end of life, but you still are living beyond and with your cancer and needing that support. So that really brings me on to why we then did this survey on the next slide, I think. So IGCAN is a network of advocacy groups and support groups. And we recognize that there is really an unmet need for support. I think a lot of women get support during their treatment and maybe for the acute physical side effects, but afterwards can feel very alone. So we really, in order to help people, we need to know from the women and from their families who are affected by the cancer, what those needs are. So that's why we developed the survey. And we were very keen, because we are a global network, to try and discover what the needs were in different countries and different groups within the countries. What services do people want? What do they need? And what have they found useful if they've had them? Because we're also aware there's great work being done by many groups, but if we can help to spread that best practice and connect support groups and foster and mentor new groups, then we can hopefully spread information, raise awareness, and do education, both for ourselves as physicians, but also education for patients to be aware of what things they can do and what information is out there and things they should be asking their doctors. So I think if we then just go on to the next slide, I'm going to hand over to Dr. Shankar, who's done a huge amount of work pulling all of these results together. So he's going to kick off with the first results, and then I'll step back in a bit later.
Thank you, Dr. Ross. So this was an important project for us, and there was a lot of discussion about the survivorship care plans. We decided to know about, and we were very enthusiastic about this. We prepared the questionnaire, 48 questions, distributed in 8 sections, and we were hoping for more responses, but understanding the complex quality of the questionnaire, 48 questions, it was not easy to answer. So we finally, gathered 407 responses from 34 countries, and this is the power of IGCS that spread over many countries. So globally distribution, if I see that, how many the maximum responses we got from America. So, 37% responders were from United States of America, followed by 12% from Italy. If you see the reason why distribution, America, followed by Asia, followed by Europe, and in the distribution of high income, low and middle income. So, as I said, that maximum responses from, America and Europe. So high income country was maximum in number, followed by the low middle income country. Among the low middle income country, Indian contribution was maximum. So it is good for me because I'm the part of the committee, and we can understand the IGCS is a state institution in United States of America. So it's maximum responses from US, followed by chair of this committee is from Italy. So it was second was from Italy. And I think it is good moment for me that we Indian responded in the way, but we after this, seminar, we want to spread it more, and we want more responses because it is very important to have more responses to make a good template and a better survivorship care plan. So now for the next section, like raising awareness section, I just request the Dr. Rosberg to, take it over.
Thank you.
Okay, so this is, I guess this is my slide. So ovarian cancer, I just said that maximum responses were from high-income countries where ovarian cancer is the most common cancers. And when you see that 13% responder were patient of cervical cancer, so it is mostly from the low and middle income country. And we divided it into 2 sections, either the people who are undergoing treatment or who has completed their treatment and from, and they are on follow-up. So 28% were on treatment, 72% completed their treatment and were on follow-up. And, this kind of survey were mostly responded by people in the urban area, 41%, and 44% suburban area. And among the people who responded from the rural area, maximum responders from India. So these are the distribution of the patient we just recruited for this project. So over to Dr. Ross.
Thank you very much. So I think if we move on to the next slide, one of our first questions that we were asking was really about awareness of symptoms. There we go. Yeah. So we asked women, before your diagnosis, were you knowledgeable of the symptoms of your type of cancer? And very strikingly, only 13% or just nearly 14% said that they were aware of the symptoms that would be suggestive of their kind of cancer. And of those that said no, nearly 70% said they would have sought help sooner if they had been aware of their symptoms. And we know that getting an early diagnosis can make such a difference to outcomes. So this is really critical. I think it was encouraging when we asked how the time between the onset of symptoms and seeking help, that still the majority were seeking help within less than a month or within 2 months, but nevertheless we're still 37% who waited more than 3 months. So it just shows that actually raising awareness is an absolutely critical thing for us to do, and we need to look at ways of doing that across the world in countries maybe where they haven't got the same information available. So if we just go on to the next slide. So we asked them what people felt would be the best way of raising awareness. And as times are moving on, it was very interesting to see that social media was one of the ones that was really highlighted as the thing that people thought would be the most helpful. They also felt that having information from their caregivers, health caregivers was important. And I think we also need to remember and maybe educate primary healthcare providers about symptoms to look out for in different cancers, making people aware that when they go for their cervical screening, that's not going to detect ovarian cancer, for example, but they do need to present if they get different symptoms, because these are opportunities when we can intervene. And that's certainly a time where women felt they did want to receive that information, but they were also keen to see things in radio, TV, so there's more standard sort of media outlets, and also through advocacy and support group websites. I think an important thing is we also need to educate healthcare providers, and that was raised by them, so that when people do go with their symptoms, they're acted upon appropriately. But we certainly always welcome, ideas from people around the world about what they feel would be useful in their countries, and things that we can do to support, whether that's translating information sheets, developing webinars like this. And I can see that there's one Q&A saying, please bring it to Nigeria. And absolutely, we want to do that. And I would be very interested in hearing ways that you think that would be helpful. So I suppose just that's opening it up now for some questions. Eva-Maria, I don't know whether you have any comments particularly about those results so far.
Yes, I think they were really interesting, and it is sad to hear that it's only 13–14% that knows the symptoms. So I think here we have a lot to do, but I also think that we do very much in every country, but I think we should think about other things, how to get the awareness about symptoms and gynecological cancer in that country, because every country is different and how it's the best suits them to give information. But also the nurses are important. They should give awareness also and tell people and patients about the symptoms. But I think it's sad that it's only 14%, but we have much to do here already, so that's good.
Thank you, Eva-Maria. And I'd like to thank again Dr. Shankar for your efforts in this important project for IGCAN and for IGCS. And thank you, Ross, for these amazing 2 first results. So most patients did not have knowledge of their cancer symptoms before diagnosis. It's very important, this topic. Probably it's due to lack of prevention campaign by video, radio, or from doctors. So, and the second one is that the best way to diffuse awareness campaign is by web, social media, TV, and healthcare providers. So for Dr. Shankar, please, in a place where the social media or TV are not always present, available, how can we diffuse this important information about cancer and prevention? What do you think?
So thank you for asking this question. This is very important, even in the presence of social media, where you're not sure about the right information. Many of the times you see the social media, they call it, infodemic. Apart from pandemic and epidemic, it's infodemic. So, we always advise patient and health resources should always be taken from the right resources. Healthcare professionals now have to engage themselves in making people aware, apart from doing the regular work of treating patient, because otherwise those all efforts will have no sense, because we all know that early diagnosis is the key to success. And we always, tell people to, whenever you read something, and before trusting it that it is an evidence, you just go to the right resources, check it, then you also believe it, because it's all WhatsApp forwarded messages and Facebook messages are very easy to catch, and they always tell you it's very easy to believe. And finally, it is very, very difficult for a practitioner or people who are engaged in gynae cancer care or any kind of cancer care to make other people understand. And this is one of the factors. The wrong information might be, making somebody life in danger, and it is contributing a lot, especially in reference to LMICs, where there are fact checks, but it is very difficult to control that. So awareness at every level is important. You should start from healthcare professionals. You can other support group, social media for the people who are engaged in advocacy. Like there are many organizations, they have to just spread this, because wrong messages are spread very fast. So to counter those messages, we need to be sensible, and everybody has to start working on making the right information reach to the right people.
Thank you, Dr. Shankar. Thank you. And the World Ovarian Cancer Coalition congratulate with Eva-Maria and say every country is different and will require a possible different approach. So greetings to our friends from WOCC. So Miriam say, if you go to your GP and they don't recognize the symptoms, it's not used for women to know the symptoms. When you feel symptoms of ovarian cancer, you are almost always very late. So I think it's unfortunately, the ovarian cancer is a big killer, but the prevention campaign is important also for this. What do you think, Rose?
No, I think this is a very important point. And I think, as I said, educating healthcare providers is also really important, because as you say, if we raise awareness amongst women, they need to be then taken seriously and have the right tests done when they first present. And the way they present will be different in different countries. Certainly in the UK, people come through GPs. And I know that Target Ovarian Cancer actually have had a big campaign and with educational modules for general practitioners, because obviously they see people with a lot of similar symptoms, and it can be due to a number of different conditions, but it's knowing what tests to do, when not to consider that something is IBS. People don't usually develop the first diagnosis of IBS in their 50s, and that's always my mantra. They need to be investigated and not be put down to something else. So I think that's very true, and I think as we need to do it in parallel, raising awareness amongst the public, but also amongst healthcare providers.
Yes, Rose. So our friend Sally from Nigeria say IGCS bring gynecological cancer awareness to Nigeria. Thank you, Sally, and I will working for this. So now another questions. Niva ask, hello. Do you think creating awareness at school level is okay? What age or grades? What do you think, Dr. Shankar?
So probably the second part is very difficult to answer, but anybody now, it depends on which city, school is situated. But yes, school awareness plays very important role. We don't have to, talk about ovarian cancer in detail, but yes, cancer as per se is very important. Now, every school they conduct a regular now education activity related to cancer. So now people know about it, and the students are the one who is going to be at risk in future. And now in the new era, parents believe so much on their, the kids, and whatever they learn, it is going to, help their parents and other people in the society, because they are the future of the society. So probably school awareness and creating awareness about other risk factors is more important than cancer itself, because there are risk factors for non-communicable diseases, which is healthy, teaching about tobacco use, alcohol, restriction, healthy diet, and which has a major impact on cancer to occur. So health promotion activities are part of the school program. But yes, apart from that, they should have a disease awareness is also important. So it should be important, and probably 8th class onwards will be the right time to make the kids aware about cancer.
Thank you. Rose?
I think that's very true as well. And I think it's really important that we try to move away from the taboo of talking about gynecological symptoms, organs. It may not be that we need education about, as you said, cancer specifically. I think prevention and risk factors is important, but also just making people aware of their own bodies, that it's okay to talk about them, because you can't present with your symptoms if you don't know anything about your own anatomy. And I think those are important things for girls to be aware of and not feel uncomfortable talking about them.
Thank you.
Yes, and I also want to say that the HPV vaccinations and the information about that is in schools in many, many countries. So that's also an important thing.
Yeah.
Thank you. Thank you all. I really appreciate the question from audience, so please continue. And now let's move on to our next survey results section, support needs. Please, Rose.
Thank you. Yeah, so we asked people about what symptoms and difficulties they'd experienced. So if we just go to the next slide. The first thing we asked about was about physical symptoms, and I think you can see this is a busy slide with a lot of different things, and many of them are things we would expect, particularly during the acute phase of treatment, and that's sometimes when I think physicians are better at supporting people, but a lot of things will continue on after the treatment finishes, and that's where we're maybe not so good at providing the ongoing support. I thought the really striking thing that came out of this was the number of women who reported fatigue as a big physical symptom. But there were also other things associated, particularly with menopause, infertility, general loss of strength, and difficulty with sleeping and concentration, which are all obviously big challenges. I think it was important just to say that they had very good number of patients who did answer this, 341, and I'll come back to that when we get to some of the other needs. So just going on to the next slide. We then asked people about sort of psychological and emotional concerns that they'd struggled with since their cancer diagnosis. And here it was again interesting to see that a very high proportion of women had struggling with anger, sadness, depression, anxiety, then also with defining a new sense of normal, and very strikingly the fear of recurrence and living with uncertainty. And I think that often gets put down as something that, oh, well, you would expect that, but actually those sort of concerns can become really overwhelming and really impact on people's quality of life. And there's good evidence that the cognitive behavioral therapy type programs, including ones that can be delivered online, can really help with that. I think these also, feeling alone and isolation, and that's something where support groups can actually help people, because although they may get support from their families, sometimes they don't feel comfortable asking for that support, or they don't have it. And I think that's something we don't want people to be feeling isolated when in this day and age. So if we go on to the next one. So we asked people about sexuality related concerns, And I think this was really important question, and something that we don't always ask enough, I think, as physicians, and people may feel uncomfortable talking about it. But this is where I just wanted to point out how many women answered this question and obviously feel quite strongly about it. We see that sexual dysfunction, issues with body image, loss of desire, all things that are, very, very important and affecting a large number of women. And it's something that we would like to help with. So just going on to the next slide. So financial concerns, clearly a cancer diagnosis can have a huge impact on earning capacity, but if you're having to pay treatment costs, and we saw that 41% of women had financial concerns about their treatment costs, and really worryingly, there were 20% who had delayed or not received treatment because of those concerns. And we don't have a simple solution to this, but I think it's something that we need to be very aware of and looking in our individual countries to see the best ways that we can help to support women so that money is not the thing that's stopping them getting treatment. And then the next slide. So late effects. So unfortunately, and as Eva-Maria has mentioned, the side effects of chemotherapy of cancer treatment don't necessarily go away, and they may develop later. So we asked women how many had experienced late effects, and it was over 60% had experienced late effects. And I think of a huge concern to me was that 51% said they had been warned, but 49% had not been warned about the potential for late side effects. So I think that's an education piece for us as healthcare providers. 45% had not been given any support to cope with those late side effects. And we know that there are a lot of things that can be done to help mitigate them. And 57% saying that they were impacting their quality of life, showing that there really is a need for us to do more work in terms of late side effects. And then I think I'll hand over to Dr. Shankar, who's going to talk a little bit about
coming to thank you, Ross. So this is one of the important area, palliative care. We talk more often, and WHO definition has changed over the period of time. But in the survey, when asked about how have you or our loved one been offered a referral to palliative care services, and almost majority of the answers, like 42% has answered, like no further anti-cancer treatment option were available, then they were referred, and which WHO says that palliative care should be started as soon as you're diagnosed with cancer. So almost 30% patients were, given palliative care referral at the time of diagnosis. When we asked about, do you think that palliative care would be helpful? And that is a very positive news that 92% of the respondents said yes, palliative care will be helpful. So that is, credit to the palliative care expert around the globe that they have really made it understand so well to the people, are diagnosed with the cancer, how palliative care is important. Next slide, please. So when we asked, were you offered support for the following as a part of your treatment plan? So majority of the patients said yes. For their physical need, they were offered, support, followed by the psychological and emotional need in terms of counseling. And this two area needs to be worked more. But the unfortunate part was that around 34% were not offered support for any of the above. And that is the one thing which necessitates the use of survivorship care plan to have more uniformity and more homogeneity in terms of offering survivorship care plan for having better quality of life and access to all this facility, irrespective of their any socioeconomic strata. If support services were available, what were these and which did you participate? When we asked this question, probably most of the people, agree that we wanted to have peer-to-peer support group, and that really is a good way to learn from the patient. And most of the patient have similar kind of complaints so that they can learn from each other. And approximately 25%, said that they did not participate in any of this above. Next. in the next section, when we wanted to know that what services do women want, if they are diagnosed with cancer. So the majority of the answer, 39%, was not informed about and signposted or any of their services, and many of the people thought that it's not needed for them, so they did not participate in that. Many of the things, the majority, one responder, we also asked about the open-ended question, if you have anything else to share. Few of the patients said that their family, their daughter, they are the biggest support in during this cancer journey, so they did not require any kind of support system whatever has been given to them, and they didn't feel during the cancer journey, if support services were not available, what would be the most helpful. And we asked them to select the best choices, and 55% again went for peer-to-peer support group. So it is important, we asked all this question to know that which kind of support is needed for a cancer patient, and over the period of time, whenever we come with the template of the survivorship care plan, what are the area. And it has a great disparity. If you see comparison from the low and middle income country to the higher country, most of the patient has no idea what is the cancer, this support group, and they are not aware about any support group. Their only concern in LMICs was to reach to the hospital and just get the treatment and get themselves cured. So how would you most like to receive support? 46%, and I think this is a great trust on the healthcare provider, that 46% responded that they want support from their healthcare provider, and patient advocacy and support organization, it was a choice for 31% of the patient. And when we asked about, are you aware of cancer specific peer-to-peer support group in your country, 55% said no, and mostly in LMICs like India, most of the people said no, they have no idea, they are not aware about any such peer-to-peer support group. So when we asked about, interestingly, will you be joining in a specific, cancer specific peer-to-peer support group, 51% said yes, 39% said no, and 10% not sure, and it depends that what kind of advantages they are going to get it. And in no category, I will say that there is many things to do in terms of LMICs, because they don't understand what kind of support their support is only means their family support. They don't need the other way of getting support for the better treatment journey. So most of the people straightway say no. So there is many work to be done in reference to LMICs when you compare to the higher income country. Next. So I think
Yeah.
Daniela for the question.
Yes, so thank you, Dr. Shankar, and thank you, Ross, for reviewing over the support needs survey results. So I think these are amazing results and data. Patients have fear of recurrence, living with uncertainty and having anxiety and depression sometimes, and the women have experienced a loss of desire and with important trouble in the sexuality. So, Ross, what do you think about physician can help patients about her physical and psychological issues, for example, with specific services in hospital or support in own house?
I think the most important thing is we have to ask what people, if we don't ask, people probably won't tell us. I think when they come for consultations, at the top of their mind is the cancer back? What are my results? Whatever. And we do need to ask. I think we also have to recognize that we can't provide all of that support in a small outpatient clinic, in a short time. So we need to be aware of what services are around and try to help to develop those. And I think, we're very lucky in the UK. We have a number of advocacy groups who provide support through those. In my own institution, we're very lucky. We have the Maggie Centre, which provides great support. and has a number of different programs running, helping people return to normal, get back to work. And also we have a fear of recurrence course, which has been very popular and really helpful. I think that sexuality is something that people don't often feel that comfortable talking about, and we probably need to do a bit more education of the healthcare providers, as well as making sure that we do ask. There are some very difficult symptoms but we can still help. There's still a lot that can be done.
Thank you, Rose. In fact, another crucial data is around 30% of patients said that was not offered any support for the above issues. So in Italy, also we have very lucky, like in the UK, because we have a very active advocacy group and support group. For example, ACTO support our patients behind the cure, so with integrated activities in Italy, physical activities, psychology, makeup course, pet therapy. So, Dr. Shankar, in India, do you have specific support group or advocacy group or support in the hospital, inside the hospital?
We have support group, and probably it's more in terms of breast cancer, but if you talk about gynae cancer, there are many support groups, advocacy organization, but it's not actively working the way it is working in the Western world. So they have a support to the patient, mostly limited to the financial support. Many organizations are coming. Sometimes it's mostly in the breast cancer. There are support, advocacy organization which are working for the children with cancer. So those are few, but not they have their way of working or their dimension there. They don't include, mostly limited to the financial support, because if there is a delay for any treatment or any diagnostic test, they help the people to get it done on time. So it's not inclusive, like you talk about survivorship care plan, the way we take other sexual health and counseling, because there are so many patients. So probably it is difficult to devote time and to make people understand by talking in length. They have, cancer patient have too many questions. But yes, I will say that it is just limited to the financial support and logistic support. What else is needed in terms of psychological care, mental health, social support, it's and sexuality related, it is less. And if I say that related to the gynae cancer specific advocacy group, I don't remember any one of them. So either it's cancer for the whole cancer, and specific I can say breast cancer and pediatric cancer.
Thank you, Dr. Shankar. And Eva-Maria, did you have any support during your cancer path by advocacy group or other support?
Yes, it's a good question. I didn't know about any support groups at that time, but I was Googling and asking, and then I found a cancer group, but it was just for cancer. So many years after, just for 4 years ago, I was talking about that we should build in Finland our own and the first gynecological cancer group. So I'm really, really happy that I have been a part of this, and we have now in Finland the only gynecological cancer support group. And we are really, really glad to have patients coming to us, and also doctors and nurses who knows about us, and we have good cooperation. And I also want to go back to the survey and to the recurrence and fear of recurrence, because I think the biggest fear for patients are the fear of recurrence and that the cancer is coming back. So even if you have lived long with your cancer or without your cancer, the fear is always going to be there. It's not going anywhere. And everyone have their own strength and this feeling and own strategy how to cope with this recurrence fear. and they find a normal life, but it's not normal, it's a new normal life. And the recurrence fear is always going to be there. And if a cancer patient feel it hard, it's good to get professional help or go to support groups and talk to somebody who has gone through the same thoughts and feelings. And also nowadays, cancer patients live longer and they can have a good life and good quality of life after treatments. And therefore, quality of life is going to be more and more important. And I think that we cancer patients also need to get adequate rehabilitation right from the diagnosis, but also a rehabilitation plan. In every country, it's not so common to have a rehabilitation plan. So now if we also could get a survivorship care plan, it's really, really important. And also I want to talk something about the struggles, the physical struggles like fatigue and memory loss and loss of strength. That is really common, and I have those three and many, many more. So when we know that fatigue is a big issue for cancer patients, I think we need, and healthcare professionals need to take this serious and try to get some research also about it so we can help the patients even better. Thank you.
Thank you, Eva-Maria. You are an amazing mom, an amazing wife. You work and you are very active with the support group and advocacy also in IGCAN. So thank you very much. So now, thank you for the inside discussion. So our final survey results review will be on individualized care and survivorship plan. Dr. Shankar, please.
Okay. Thank you, Daniela. So what is survivorship plan? A record of cancer diagnosis and treatment history. This consists of a plan for monitoring cancer recurrence and detection of new cancers, a plan for assessing and managing long-term effects associated with cancer and or its treatment, services to ensure that cancer survivor needs are met at the end of the day. And it also includes family members and caregivers. In my personal opinion, they live the life of the cancer patient and they are the close associate. And whenever you just, and there is not much to think about them. So there is another agenda we are trying to, cover and we have covered it in our survey, in another survey. When we asked, did you receive an individualized plan to support your transition out of treatment? Because it is very important that cancer patient after treatment become a cancer survivor. So the answer was, if in 59% of the responders said no, they did not receive an individualized plan to become a survivorship when they become a survivor from a cancer patient. So have you ever been given a survivorship care plan? And this is very unfortunate. Only 20% said yes. And that is the thing area where we need to work a lot, and we need to just, come up with a, common, or which is, we can just modify as per the need of different country LMICs, high income groups, so that we can provide a better cancer survivorship plan. And interestingly, I was just going through the open-ended answer of the one patient. One said that I did not receive any survivorship care plan. And interestingly, after 12 years of survivorship, one postdoc contacted me and he gave me a survivorship care plan. So, and I was lucky enough to get a survivorship care plan after 12 years of my cancer diagnosis. And many of the people enforce that there should be a, when you are having a transition from a cancer patient to survivor, there is much to be done. Many of the people are, sent to the prevention clinic to have a preventive checkup. So these are the agenda for this survey, to have a better survivorship plans. So next question, please. Next slide. So follow-up is a very important, and most of in our hospital setup, we know, and we teach always that, okay, in your first year, you have to come for every 3 months. Second year, we have another follow-up plans until 5 years, after 5 years. And 85% of the patients said yes, wherever they were treated, they got follow-up plans. But follow-up plans and survivorship plans is two different things. And we are talking about a bigger perspective. By follow-up is one of them, but in follow-up, what needs to be checklist that you need to tick, and you need to be cautious enough so that it helps you in to serve your patient in a better way. Your need may change as time goes. So we ask patient, what do you think that what is the best way for your healthcare provider monitoring your changing needs? So most, the highest response is 50% said that there should be a named support worker who would contact between the appointment. And that is, the way you can make your, patient care better. And a questionnaire prior to hospital appointment was in 20%. And many of the people in the era of telemedicine said that a telehealth, will help them, in a better way. So this is the end of the survey question. I will now request, Daniela to take it forward and for the further question.
Thank you, Dr. Shankar. So the lack of survivorship plan is an important issue. So most of patients, as we read, did not have a survivorship plan. So for patients, knowledge and having a specific plan for treatment and follow-up make patients less fearful and anxious. Patients feel more reassured and monitoring. So I asked to Dr. Shankar, do you have in your hospital specific survivorship plan? So you are on mute. Dr. Shankar are on mute. Yeah.
So it's a big no to this question because we don't have a survivorship care plan, but yes, we have a robust follow-up care plans for every patient who are treated, in our hospital. So I can see there is one question from Nepal, Dr. Kishore. So Daniela, that is unaddressed.
Yeah, I think primary prevention and screening programs are important to prevent cancer. How about HPV vaccination effectiveness to decrease cervical cancer in the United States? Said Kishore from Nepal. Thank you for your questions. So I don't know specific for the United States, but IGCS, according with WHO, is working in an important project worldwide to eradicate the cervical cancer with vaccination. We hope to have in 2030 the first results for this topic. Thank you.
So to answer this question, primary prevention is helps you to prevent cancer for sure, health promotion activity. And for more detail, you should read the World Code Against Cancer or European Code Against Cancer. Screening help you to detect cancer early, and it is a type of secondary prevention. So an HPV vaccination, there was one study in which there was a comparison in US states where cervical cancer vaccination was more, they have a less mortality from cervical cancer. So, and the one country which has Australia is about to, achieve the elimination of cervical cancer. The target is 4 per 100,000, women cervical cancer incident. So hope I have answered the question of Dr. Kishore. So
thank you, Dr. Shankar. So unfortunately the time is short, so okay, we'll go. So this concludes our Q&A, and we will now share Manisha Koirala video and her perspective on survivorship.
Diagnosed with cancer, there was so many misinformation out there, and luckily I had a very good doctor in Nepal who said, Manisha, the world has advanced in terms of cancer. There are multiple choices for treatment. People are surviving long, so do not lose hope with this diagnosis. With every step of success that I faced, there was another fear lurking around the corner, because after first thing was to get a successful surgery done. That my surgery was 11 hours. It was successful. I had a very kind doctor who had already prepared my families by saying, if I come back early, then you should worry. But if I'm taking a lot of time, please do not worry. That means I'm working at getting every cancer cell possible out of the body. So, I mean, somehow I've always had a great doctor supporting during that fearful phase. So I had a successful surgery, but then again, the next step was will the chemotherapy work on me? And so the oncologist came on board after that, and she, and with each dose that was given, there was a lot of turmoil, a lot of fear, a lot of trauma that we all, me and my entire family and people who care for me, all of us faced it together. And again, my oncologist was one of the most compassionate oncologists, and she would actually encourage me by saying, Manisha, you're doing so well, you should focus on the good aspect and all that. So now, me as a patient, I must do what is best for me otherwise. So my emotional health, my physical activity, the nutritional part, I started educating myself. Not only me, my treatment was successful, my surgery was successful. Now I need to do work with my new body, because a lot of my organs are not there. The fear factor is always looming around. I started having anxiety pangs. But it's like I think again, I had to train myself. I have elderly parents, and also a lot of other cancer survivors. They started informing me what all to do. But of course, I mean, it takes that fear of relapse was humongous, but I had to, at the end of 2 years, I just had to make a decision to say, okay, I mean, am I going to be living with the fear of relapse, or should I just start looking at the positive, which my doctors have been advising me since day one. My oncologist, Dr. Macker, was telling me since day one, start looking at the positive. Your cancer markers are going down. The cocktails of chemo that we are giving you is working wonders for you. Just start looking at these numbers and look at, you are doing so well. So I had to somehow train myself not to go on a relapse mode, but to start thinking, okay, I've lived so far. I am doing my blood check, because blood test is a good marker for me. That's what my doctors had told me. So I was doing blood test every month. I didn't need to do it, but I was doing it, and I was fine. So somehow, with every step, the hurdles started coming in, but I had support system. I had kind people around me. And I feel that really has helped me a lot. I was blessed with kind people around me all the time. And I never, one of the nicest good advice I received from another cancer patient, Lisa Rani Ray. She is also a survivor. She had taught me this. She said, Manisha, do not be shy of asking for help. And I took that in. So I think with every year passing, and with every hurdle, I started realizing, how silly my worry was. And I started looking into the positive. I also started saying that, okay, fine, now it becomes my responsibility to do the right thing for my body, to, whatever there is information available. I started reading lots of books. I started, checking out what is nutritional uh, value food, what kind of nutrition I should eat. So I was consulting. I had a side this thing with nutritionist. I had a therapist with me. I had a yoga teacher. I had pranayam, breathwork teacher. So I just have a huge support system, a group of people with whom I continuously work now. And I do, and anytime I always take guidance from my doctors. If there's anything worries me, I reach out to them, and I've been blessed with kind doctors, kind support system, the people, my family members, my friends. So yeah.
So I think you are very blessed with a very strong pillar system around you, and
Yeah.
I have seen that you just come out and try to help everyone who approaches you for cancer treatment, and that is so great about you. You are a support for many people in India and Nepal, and I can see this is beyond any socioeconomic status or anything, and that is so great about you. Don't Have you heard about cancer survivorship before? And do you think after treatment there is a need for survivorship care plan? And this cancer advocacy needs to be talked much about because there is so much of disparity. You had an excess of everything, but many of the people needs it more, but they don't have an access. Your comment on this?
So I honestly did not know or anything about cancer survivorship. I wish I had known it, but I didn't. I I think I would actually like to know what does that do. But in my perspective, as a patient, um, I would want all sorts of support system for the patient, and especially in a mental and emotional and nutritional and physical everything, because I feel that plays a huge part. The anxiety is humongous, and a lot of people don't have great family support, and they feel lonely, and they feel isolated. And so it's if there is a support group, if there is this thing, it'll make a lot of difference, I came across some section when I was working, when I met the young children with cancer and their parents. I found that they were isolated. There was a stigma attached, and so much so that because there's so much of a misinformation in our part of the world, that if you touch the cancer patient, that other person will get cancer. I mean, that's so much of a misinformation is around. So to navigate, to just basically nullify those things, I think people should talk, and they should come out and speak more, and there should be more debate. It shouldn't be a taboo topic. Also, I must want to share this, that after cancer, and I've been like noticing it for a while, after cancer, whoever has survived, they probably lead a better quality of life than they did before, because the value of health, the value of life is so clearly evident for us, because it's like you face the almost like a near death, and then you come back to life. So I think there is a zeal, there is this fighting spirit, that no. And that's what I mean, there was a stigma attached to whether I will be able to look nice or not, because I'm an actor, and will I have enough stamina or not, or will I fall sick again. So I had to really prove myself, every step of the way, that I am as good as before, if not better. So I guess every cancer patient, if they get this support, you don't need to feel lesser than anybody, and you don't need to feel alone. If there is some sort of a support system, if people start talking openly. When I was diagnosed, there was so much of misinformation. We did not know that cancer patient would live long and would have a good quality of life. There's not enough information. But today, because I see a lot of cancer patients who are leading exceptionally good life, they're healthy, looking prettier, they're working. So we need more positive stories out to give hope to people. Diagnosed with cancer, there was.
Thank you. Wonderful to hear from Manisha. So before we depart, we would like to share the future topics of IGCS Advocacy Committee and IGCAN have noted a need for. So this includes survivorship plans, developing a support group, sexuality and fear of recurrence. So IGCS will be sharing the results from the recent caregiver survey soon. Thank you to all the caregivers who completed the survey and shared their experience, and thank you to all members of IGCAN committee that helped us to share this survey. And a special thank to the all IGCAN and IGCS staff to believe in this project. So please stay tuned to IGCS communications for information on the caregiver survey results and for future educational offerings on the areas we have assessed need for. So the IGCS is proud to announce that June is the Uterine Cancer Awareness Month. Please visit igcs.org for more information and helping us spread awareness. So I don't know if Rose want to add something, or Dr. Shankar before close these wonderful roundtables.
I would like to thank everyone who has just completed the survey. It was not easy to complete it, and many of the people have helped me so do it, and all the caregivers and the survivors for making this a possibility.
Thank you, thank you. That concludes today's webinar. Thank you to Rose.
Well, thank you. A huge thank you to Manisha and Eva-Maria for sharing their stories and their insight into all of this, because you've been absolutely wonderful and we really appreciate it. And also, yes, to all the women, I know it's difficult answering these questions and we really do want to try and do something with this. So it's been great. Yeah.
A recording of today's Patients Roundtable will be uploaded to IGCS Educational 360 Learning Portal. We thank you all for being with us today and wish you continued health and safety. Thank you, bye, and see you soon.